I think it's really important for us to make sure, irrespective of age, by the way, that we have plans that we can call upon those neighbors, friends, relatives who can speak for us when we're not able to, and they know something about the way we want to have our care managed. So with that, I'd like to call on Pat and Karen to do their presentation for us today. Thanks, Pat and Karen, for being with us.
You're welcome. It's a pleasure to be here.
Karen's going to start, but I just want to make sure that everybody's seeing the screen right now before we go any further.
Okay. I got it.
I see the nodding head, so that's a very good thing. Okay, Karen, over to you.
Okay, so who are we and why are we doing this? I was working in the chemistry lab at VGH, and we were going through I don't know, the second or third restructuring process, and my workplace was angry. Every day I went there and they were angry, angry, angry. So I decided that I needed to have some patient contact to put things in perspective. And so I became a volunteer on the palliative care unit at VGH. And that's where I met Pat. Pat was the clinical nurse specialist on PCU. And after that role, she went on to be the regional lead for Vancouver Coastal Health for end of life care. And in that role, she was instrumental in helping to get the legislature around advanced care planning to be what we know it to be today, which is available to one and all, free of charge. You don't need a lawyer, those kinds of things. One thing that, even though Pat and I were in very different roles, we both were able to see up close and personal the difference that advanced care planning made to the patients and their families. Those who had gone to the trouble of figuring out what kind of care they wanted and what kind of care was right for them, there was just more of a calmness, and with the family there was harmony. And those who hadn't thought about it before were in a situation where, you know, they had to make lots of decisions in a medical crisis, which is not a great time to have to make medical decisions. The focus we have for today's session is the why, the who, the when, and the how of advanced care planning, and the important conversations that we must have with those close to you and your healthcare providers. We're going to give you a concise overview of advanced care planning. We have a very detailed handout. That's why we need your email addresses, and a wonderful resource list for further information. The handout, by the way, has everything that is in our presentation, all the concepts and the definitions, and everything is there that you're going to hear from us. And the resource list is wonderful. We hope that when you leave this session that you'll be comfortable to talk about your future healthcare decisions with your family, and even doing the thinking and working that you have to do yourself to have an advanced care plan. We will stop for questions at intervals, and as questions come up, if you put them in the chat box, then we'll be able to answer those questions as we go along.
So I'm going to talk a little bit about this life planning model, because as Karen introduced us, she talked about end of life care, but really with advanced care planning, there's a real emphasis going on about the fact that we need to be doing this much earlier in our lives, and that we need to situate it within our thinking about a life planning model. So we do estate planning, we think about wills. Sometimes people think about funeral planning. Financial planning starts very early in our lives, that people start saving money for education for their children, retirement. And an important thing that many of us do at the time that we do a will is look at appointing enduring powers of attorney. So advanced care planning needs to be situated within our health planning. This is something that we need to be doing, and not just in preparation for end of life, where we may not be able to make decisions for ourselves, but we need to do it much earlier, because we don't know when things might change with our health. And part of advanced care planning, such as thinking about donors, being an organ donor, that is something that we need to do much earlier in our life. So we're really trying to shift advanced care planning into this, being part of life planning. And some of you may have been exposed to this in terms of visiting a lawyer about doing a will, and that the concept of representative came up. So we'll be talking later more about representatives, but just to kind of really emphasize this shift, that we say, it's never too early, but it might be too late to do advanced care planning. And I'm going to...
Yeah. So what are the benefits of advanced care planning? Well, for you, you get to know yourself better and understand what's important and what really matters to you. Now, when I did my advanced care planning, I sat down and thought, oh, well, that's easy. I'll just sit here and write down those things. And guess what? It wasn't that easy. I ended up having a piece of paper, a sheet of paper on my dining room table. And as I thought of things, I jotted them down, and I did a lot of editing. So, and when it finally came down to figuring out what was important to me, it just felt like that was the foundation that I was going to build on for my advanced care plan. It also, another advantage for you, of course, is peace of mind. Everyone knows your wishes, and that also is very comforting. For the family, for your friends and family, it's a gift. They don't have to try and figure out what you would have wanted. And there's always, in families, there's always different points of view on that particular point. And this way, it just takes that eliminates that. It identifies, your advanced care plan will identify who will speak for you, and it reduces conflict amongst your family and friends. And it helps the person you decide to speak for you communicate better with your healthcare providers. Everyone is guided by your wishes. By the way, when I say family here, I use that in the broadest sense of the word. Whoever is close to you, that is who we determine as your family. So what is ACP? Well, it's a process of thinking and talking about your future health decisions with those closest to you. The goal is to get the care that's right for you, and it's personal. It's whatever care you want and what you think is right for you, even if you are unable to speak for yourself. So that's an important key, which Pat will get into the whys and wherefores of that in a little bit. There's 3 steps to advanced care planning: the thinking, which you do with yourself; the talking, which you do with hopefully everybody in your world; and writing down your plan. So who should do ACP, and when should they do it? Well, all capable adults especially should do ACP, and it doesn't matter. Age doesn't matter. As Pat mentioned before, your ACP is relevant at any age in your life. But most especially, you should do it if you've been diagnosed with a serious illness, or you know that your family might have different beliefs or views, or if you're in the stages of early dementia where you know in the future you're going to lose capability to make decisions. And like I mentioned a little bit earlier, do it before you're in a medical crisis or become seriously ill. And as Pat said, it's never too early until it's too late. I think it's your turn, Pat.
It's you still. I think what matters to you is still you, isn't it?
It is. You're right. How did I do that? Okay. So when you're thinking about what stage of your life you're in, and that determines what your advanced care plan is going to be. If you are a young person, if you're healthy, then mostly what you have to determine is, if you want to be an organ donor. And the most important thing is who will speak for you if you're unable to speak for yourself. If you have a serious illness, or you're aging or becoming more frail, then the focus of your advanced care plan changes a little bit. And you might want to think about the quality of your life versus the quantity of your life. And that becomes the basis of your advanced care plan. If you're in an end of life situation, the things you want to think about are, what does suffering mean? What does comfort mean to me? Those kinds of things. What would matter to me if I became unwell and couldn't communicate? What are my biggest fears and worries about the future of my health? And the next slide is key things to remember. No, I don't think that's a slide, is it, Pat? No, okay. So the key things to remember about advanced care planning are that every adult should do it. It's totally voluntary, and there's no right way or wrong way to do it. And it is a process. It's not something you're going to sit down and finish tonight. It's going to, you're going to work on it, and you're going to revise it, and you're going to edit it. And in the end, you're going to get an advanced care plan that directs future health care that's exactly right for you and your family. The conversations with your family aren't easy, but I think more and more it's more, advanced care planning is becoming more mainstream. So people are hearing about it, people know about it, people want to know more. And the more conversations you have, the easier it becomes.
So healthcare decisions, capability and consent. If you require healthcare and can provide consent, in other words, you're capable, you will always be asked. So your advanced care planning never takes the place of you if you are capable of making decisions. What advanced care planning does is, as Karen has already mentioned, we're going to be talking about, is give direction as to who makes decisions for you if you can't do it. And it also gives them some direction based on your thinking about both what those decisions should be and how you would want those decisions to be made. So what you are really doing in this process is giving healthcare consent in advance. What we want to end up with is the care that is right for us. But consent is the process of giving or refusing permission for care prior to its time. And informed consent is making sure that we really understand the treatment that you are going to receive, the risks and the benefits. So if you frame advanced care planning in your mind as this process of giving advance consent, either through the people that you have appointed, or through what you have told to them, or actually both of those processes, I should say. It's not an or, it's an and. So thinking about this then in terms of who can make decisions for you if you can't. Right now you have the opportunity to look at two different options. One is that deciding who speaks for you and doing a representation agreement, or if you want your healthcare provider to decide based on temporary substitute decision maker, and we'll again talk a bit more about what that temporary substitute decision maker decision looks like. Those are the two choices that you have now. Regardless of which of those choices you choose, the important thing is choosing a good substitute decision maker, someone that's going to honor your wishes, even if they're different from their own. And that is really important. You know, you may know someone who thinks differently than you, but you know that they will respect what your thoughts are in terms of what your healthcare decision should be. So that idea of honoring your wishes is really important. Also think about somebody who's reasonably calm in a crisis. And, you don't want somebody that already has a huge burden with anxiety, that you may in fact make their situation more difficult, but they may also not be able to act for you in the way that you would want. That they feel comfortable communicating with healthcare providers. And I know a lot of people, when they look at their constellation in terms of the choices that they have for substitute decision makers, sometimes choose someone either in their family or friends that is a healthcare provider. But you certainly don't need to be a healthcare provider. All you need is somebody who feels comfortable discussing things with healthcare providers. That they won't be pressured into accepting treatment that they know you don't want. And that also means usually that they can handle conflict or disagreement. And the conflict or disagreement may not be within the healthcare team. It may be within the family group, and trying to manage and respect all members of the family, because usually people are all motivated by love, but actually they may not, in fact, interpret your wishes in the same way. And so again, that's why you're doing advanced care planning, to help make sure people interpret the wishes that in the way that you would want them. So in BC, our legislation provides for us doing representation agreements. And in fact, there's two different representation agreements. There's a representation agreement 7 and there's a 9. Today, we're going to be talking about the 9. And the differences between the 7 and the 9 are that you need to be fully capable in order to do a 9. And that means that you need to understand the scope of power that you're giving this person. And if you give somebody the power to act as your representative under a Section 9, you are giving them the choice of making decisions, healthcare decisions for you that include whether you want the continuation of life prolonging treatment or not. So it's a lot of power that you give people, as I've mentioned earlier, and I keep repeating, as long as you're capable, you'll be the one that makes those decisions. But if you're not, then if you have given that someone the power to do that as your representative in a Section 9, they can make that decision for you. You can have a couple of people as representatives, either a primary and alternative or shared power. There are different ways of doing this. And often people think about maybe someone right now, but because although we encourage people to review their advanced care planning and update it, we're all not so good about doing that, that it's also good to maybe think about an alternative who might be younger, in case you haven't done that review and actually the person that you have chosen as representative isn't able to any longer act in that capacity. Then you have an alternative who is younger. And just as an example, in my situation, my husband is my representative, but one of my sons is my alternative to cover those two possibilities. So it's useful to think about it in this way. As Karen mentioned, the legislation that came into effect in 2011 allowed for representation agreements to be done without a lawyer or a notary public. You need to have witnesses. It's a legal document when you do a representation agreement, but you don't need to have a lawyer or a notary do this for you. So I think those are the important things to emphasize there. I'll just move on to talk about temporary substitute decision makers. So I mentioned that if you haven't done a representation agreement and appointed someone who's going to make decisions for you if you can't, what will happen is that the healthcare provider will make that decision and ask somebody to become your temporary substitute decision maker. And this happens a lot in healthcare because not so many people have done representation agreements, although certainly more and more people have them. But what happens with the temporary substitute decision maker is the healthcare provider needs to follow a hierarchy in terms of who they ask. So it's not that they're given permission to kind of willy-nilly just ask anybody. They need to start in terms of this hierarchy. So the first person that they would go to, and I think this list, when people look at it, seems logical. It's who you would expect they would go to. So they go to your spouse, and then next to the spouse, they would go to your child, and children, regardless of age or sex. So all children are kind of ranked equally, and it would be basically who they get a hold of. And then your parents, brother or sister, and so on down the list. Some of the things that were good when the legislation was changed in 2011 was that a close friend can be identified by you on your temporary substitute decision maker list that we should do when we do advanced care planning, and so that they would be able to go to that person. And this was a great relief to a lot of people who really did not have any family that they were in contact with, or who were in a position to act as a temporary substitute decision maker for them. So the fact that the healthcare providers can go to close friends is good. Often people, if they're going to recommend a close friend, will decide to make that person their representative, as opposed to relying on the healthcare provider using the list. But at least it is identified as one of the possibilities. And so the other thing that's important with the temporary substitute decision maker, in regards to the fact that, in addition to the fact that they have to follow the hierarchy, is that the person must be 19 years of age. They must be capable. They must have no dispute with you and have been in contact with you in the past year. So again, as we are working on our advanced care plans, we can do lists about temporary substitute decision makers if we haven't done a representation agreement. And we can identify people that might be in any of these categories that perhaps we don't have, that we haven't seen, that we perhaps have had a dispute with, or perhaps would not be in a position to be capable to act in that capacity. But basically what we recommend with advanced care planning is, particularly if this list of temporary substitute decision makers doesn't work for you in terms of who you would be wanting to make decisions if you couldn't, then it is really important to be doing a representation agreement. So another choice that happened with this legislation was this concept of an advance directive. And what an advance directive is a written document that you are expressing consent or refusing consent for particular types of treatment when you aren't capable of making a decision. So in a way, you are expressing your voice. Now, it sounds like the kind of thing we like to do, except that the challenge with advance directives are that they are quite powerful. Healthcare professionals can actually treat your advance directive as your voice at a time when you're not capable. But because of this, it needs to be so clear to healthcare professionals what you want. So these written instructions need to be about specific healthcare treatments. You can't make a general statement like, I wouldn't want anything that would make me uncomfortable. That wouldn't give any healthcare professional confidence that they knew exactly what your thoughts are. So we really recommend that if you feel strongly about some element of healthcare, and I'll give you an example of, for example, a Jehovah's Witness who might feel extremely strongly about not wanting to receive blood transfusions and feels comfortable writing that down in a very clear fashion for healthcare professionals. That is the kind of specific direction that is useful to use an advance directive for. And what we really recommend is when you're doing advance directives that you talk to your healthcare provider, be it your family physician, be it a specialist, and make sure that what you're thinking of in terms of your advance directive makes sense to them, and actually get help with wording, so that you have some confidence that the advance directive that you've written will give the advice that you want to your healthcare team. So that, one of the things that people do start considering about putting in an advance directive, in addition to the kind of example that I gave before about blood transfusions. Cardiopulmonary resuscitation, for example, is the kind of thing that people might decide to put into an advance directive, that, you know, describing the circumstances in which they would not want cardiopulmonary resuscitation. I also want to reassure people that if you're at a point with an illness that your medical team feels that cardiopulmonary resuscitation is not appropriate for you, they often will raise that, and in fact, the physician has the ability to fill out a form called a no CPR form. So this is not the only tool that you have to express your wishes about CPR, but it is one of the tools that you have if you decide that that's important for you. So people put other things into advance directives. Often though, this is at a stage when they are dealing with an illness and have experienced certain treatments and have come to a point where they feel comfortable making a decision about whether they would want that treatment again. And the example I'll give you is related to COVID. And I think, you know, the whole experience of going through this pandemic has probably given many of us the opportunity to think about what we would want in terms of future healthcare. And I know of a person that through COVID, he had a pre-existing lung problems and ended up through having COVID going onto a ventilator twice. And after he revived from that experience, he did an advance directive and spoke with his family and his healthcare providers to say that if he ever became that compromised in his breathing again, he would not want to go on a ventilator. So that often is the kind of experience that people have that leads them to those decisions. Because again, writing an advance directive is powerful. Certainly if you still have your voice, that is what the healthcare team is going to take direction from. So it's not taking the place of your voice, but once it exists, the healthcare team can act on that. And your representatives should also act on that advice as well. So I'll leave that. Now I'm going to stop because I haven't been looking at my chat. I don't know what questions are there, but I'm just wanting to make sure that we're answering questions. So does somebody have, maybe I can pull up my chat here. I'm worried that if I pull up my chat, I'm going to get rid of this screen, which I'm not wanting to do. So if somebody has access to chat and can let us know if there are questions that we should be answering.
Pat?
Yeah?
I just had a couple examples that I wanted to share.
Okay.
And one of them has to do with cancer, people with cancer.
Yes.
And those people having dementia. That presents a really difficult problem. Mm-hmm. So that's a situation where it's really, really important to have something in place beforehand. And many of these cases are terminal, and somebody has to make a decision on whether you want to proceed or not. Right. The other example I wanted to share with you was we had two ladies in our community, both of which had cancer. I don't know if the cancer was exactly the same or not, but one lady decided that any medication that she was going to take would only prolong life under some difficulty. And she'd rather live with the cancer and take some pain medication and let the cancer take its course and die with the cancer as it would take its normal course. The other lady wanted to take all the precautions that she could take, retreatment and so on and so forth, and she lived with horrendous difficulty in taking those medications. But she didn't live a whole lot longer. It was interesting that two people took two different decisions. One knew what the outcome was going to be and succumbed to that. The other lady wanted to try to live as long as possible with taking whatever treatment was possible that would save her. And she lived with a lot of pain and discomfort. So I think that's a consideration that needs to be taken into account when
Mhm.
you're making these decisions.
Mhm.
What kind of treatment are you really prepared to live with?
Right. So I'm going to talk about something I was going to talk about at the end right now, because it's a good place to raise it, Len. Is when I was preparing for this talk today, I was looking at the resources that BCCA has on its website in regard to advanced care planning. And it has a lot of resources. Some of them are like the information that we're sharing with you today, which is kind of general. But I found a booklet that was specific to cancer, and it was called Cancer and Advanced Care Planning. You've been diagnosed with cancer. Now what? And, if you Google that on the BCCA website, it has what I consider to be some really excellent questions for people who, firstly, are just diagnosed with cancer, but secondly, I'm sure at any point in your illness trajectory, they're good questions in terms of the conversation that you can have with your healthcare providers to give you the understanding that you need in order to make these healthcare decisions. I mean, we're talking quite generally today, because this talk has been prepared for the general public, some of whom may have illnesses, some of whom may be in their 20s, some of whom may be in their 80s. But I think what I liked about this booklet was that I think for anybody who has had an experience with cancer, the kind of questions that they ask in terms of you understanding your situation and whatnot are really good. So I would recommend taking a look at that. And I think, again, though, back to your point, Len, is the two women probably both had conversations with their healthcare providers to look at the pros and cons of treatment. We don't know what advice they were given in terms of what the healthcare providers recommended, but they obviously came also from different places in terms of their life philosophies. The woman that decided not to have treatment, probably was in a different space than that other lady in terms of her view of her body and what was good for her body and where she was in her life and whatnot, So this is why, again, with advanced care planning, you have to start with you and what your beliefs are, what you feel about where you are in your life, what you're willing to endure, and then go from there in also talking with healthcare professionals in order to make these decisions about how you go forward. But thanks for sharing those examples. Are there any other questions that people have?
I just wanted to mention, Pat, but in these two examples that I suggested to you,
yeah,
all the family members were all aware of the condition of the people and the decisions that each of them made.
Which is really important, because actually that's the slide that's up there right now, isn't it? Because you need to talk with people. Firstly, you need to think it through yourself, but then you need to talk to people. And having said that, Karen, it's over to you, right?
Right. I just before I continue with this topic, I'd just like to share a personal story, and it's my mom's story. My mom was a lovely woman, 87 years old, had a great life. She had a husband who loved and adored her for 67 years, 5 children, 10 grandchildren, and 2 great-grandchildren. And my mom was always very clear with all of us. And not just once did she say it. She said it many times over the years that when her time was up, she wanted no heroics. She was grateful for her life, no heroics, let me go. But unfortunately, my dad loved her too much and he couldn't let her go. And she was resuscitated. She lived for another 4 fairly miserable months. And when she was actively dying, Dad got into his head that opiates would shorten her life. So she was actually, when she was actively dying, she was denied really good comfort care. And what happened is this rather tore my family apart, because there was Team Dad, who was my brother and two sisters. And then another sister and I were advocating for Mom's wishes, which we were all very aware of. So as hard as that was to watch my mom suffer, it was equally as hard to watch my dad deal with his remorse and guilt for not honoring her wishes. And if my mom had just simply written on a piece of paper in her handwriting, "I want a natural death," we could have held that up to my dad, and we could have gently transitioned him to accepting what was happening. And that would have created an environment that was calm and hopefully harmonious. And she would have loved that. So that's another reason why I am so, why I do this work and why I'm so jazzed about advanced care planning. So talk with the people you trust. Well, my mom did that, but it didn't quite work out for her. She didn't talk to my dad hard enough, I guess. But we've already done the thinking what matters most to you bit. And we've done that because you can't predict everything, and it's hard to prepare for the unknown. So this is your best guarantee to ensure that your wishes are fulfilled, that everyone in your close circle knows what your wishes are and what they want. So who do you talk to? Well, you talk to everybody, but firstly, and most importantly, you talk to your substitute decision makers, so they're clear on what your wishes are. You talk to your family, and then important people in your life. It might be your clergyman or your doctor or those important people. And why do you talk to them? Well, it helps them make decisions. And what do you talk to them about? Well, you can talk about you can share your what's important and your goals, your biggest fears and worries about your future health. You let everybody in your family know who is your substitute decision maker and why you chose them to have that role. And you can ask for their support, that they will support your substitute decision makers' decisions, even if they don't agree. Does anybody have any questions about that?
I have a question.
Sure.
And it's back to a previous slide, in fact, the one just prior to the one you have up right now, where it says that your instructions must be clear and specific to the treatment that's being offered. And that causes me to wonder, how do I know what possible treatments might be offered? Because there are many medical situations to which the advanced care plan applies. And I can't, at the moment, I don't think I know what the treatment options available are.
Yes, I can clarify this, because that is in relation to an advance directive, and an advance directive is different than your advanced care plan. It can be part of it. It is a document, though, that is a written document that follows, it's a legal document. It's set out in terms of there's prescribed ways of writing it, and it must be witnessed and whatnot. And it is a document that directs healthcare providers to do something in the absence of a substitute decision maker. In other words, your healthcare provider can act on this document. If your representative wasn't present, I mean, they would still try and find someone. So I don't want to make it clear that they grab this document and not try to find substitute decision makers, but they can act on this document. If they don't have a substitute decision maker, this document is your voice. An advance directive is more specific than your advanced care plan in terms of where you express your wishes. Those wishes can be a little more global, a little more philosophical than what an advance directive is. So there's a difference between the two. An advance directive is a very specific form that has these written instructions. But some people are very, I guess I should say, happy to have this opportunity to write down something that is as specific as that, but also as powerful as that. I don't know exactly. I hope that I'm being a bit clear about the advance directive with that. Does that
And
make
it's
sense?
optional.
And it is optional. You don't have to have an advance directive as part of your advanced care plan, but it is one of the choices that you have if you decide that you would like to create an advance directive. And the forms, I'll mention this now, we talk about it when we talk about resources, but within the government documents that we mention at the end are actually templates for an advance directive and for a representation agreement.
Okay.
So does that help the person that asked that question, or is that clearer for you?
I'll hold off answering that question until we get to the end.
Okay,
And then we'll see.
fair enough. But you know, in your advanced care plan, in a more general way, you can express what your wishes are for yourself, what beliefs are guiding those wishes that would give people a sense of how you would want them to approach decisions on your behalf. And you can also let them know, as you say, about treatments that you've had, but you can't possibly be thinking about treatments that are going to be offered before, you know, maybe even before the treatment's even developed. Maybe this is 10 years hence and you don't know.
Right.
So, you know, no one would expect you to be able to do that. But also remember that as long as you're capable, you're going to be asked. So you've got the opportunity of updating this plan. Like, it shouldn't be something that you do now and then don't look at for 10 years, and you know, and your situation has changed dramatically at that point. We need to make sure that what we've said to people and what we've put into our advanced care plans really reflects our belief system and our wishes at this time. Okay, I'll stop, Karen, and we'll carry on going forward here. So I think the next one is there.
Okay, this talk with your healthcare professionals, your healthcare providers. Of course, you know, you're going to do this if you have an advanced care plan. They're going to get a copy of it. And they're also, you know, they're also a great resource for you as you're doing your advanced care plan. And you can get very specific advice and information. So talk to them. They're good.
And I just want to make a comment, because again, I went into the Cancer Agency site to see sort of how advanced care planning was being introduced to people right now. And I know some of you are probably far more familiar with that site than I am, but they now, with new patients, have their PRISM, which is the patient reported information and symptom measurement form. And actually on page 5 of that PRISM, they are now introducing people to advanced care planning. And the page starts off wishes and plans for your healthcare. And they ask whether you do have a current advanced care plan, and give a bit of not a definition, but a description of advanced care planning. And ask if you would like to talk to someone on the healthcare team about advanced care planning, or would like more information about how to write an advanced care plan. So again, as we said at the beginning of this session, what we're finding is that, you know, advanced care planning is gradually being integrated more into, you know, our thinking, both in terms of when we go to lawyers about wills, that they will bring up this issue of a representative, and with healthcare systems that are trying to incorporate questions about advanced care planning into their assessment forms and whatnot. So anyway, I think that makes it easier, is where I was coming from with this talk to your healthcare providers. Makes it a lot easier for you to introduce the topic of advanced care planning when it is part of this original or initial assessment that goes on at the Cancer Agency. Okay, so there you go, Karen.
Okay, having the conversations. I know that some of you think that this might be an awkward thing and how to start might not be particularly comfortable. And I know I had that experience with my dad. He did not want to talk about this, but that's, you know, I'll just give you a couple of ideas on how you might start these conversations, because really this is so key to advanced care planning, that everyone knows what your plans are, what you want for future healthcare decisions. You might want to say, right now I'm healthy, but I want to think ahead and be prepared if something unexpected should happen. Or you could say, I want you to be prepared if you have to make decisions on my behalf. Or I think it's really important that everyone knows what I want from my healthcare. And you kind of set the stage for these conversations, you know, somewhere that's comfortable when everybody has time to get into the conversation. And it's also more and more these days, I see this topic on TV, and a storyline for a TV show can be a great segue to start a conversation about advanced care planning. Or you might know someone and you're relaying the story of their illness journey, and that could lead into a conversation with your family about what you would want. And like I said earlier, the more conversations you have, the easier it gets. And lots of people use humor, and that's okay too. Whatever's comfortable with you and your family, you know them best. Okay.
So we've talked about the thinking that you need to do, the conversations that you need to have, and then the importance of writing some of this down. So what is an advanced care plan is a documentation of your wishes. Also, to write down the information for your temporary substitute decision makers. We mentioned that you can do a representation agreement, though that's optional. It may be the best thing for you to do, but even if you've done a representation agreement, it's still important to note who your temporary substitute decision makers might be, just in case it's an emergency and they can't reach your representative or your representatives. So it's important to still document who those people might be, your temporary substitute decision makers. And another optional thing is this advance directive. So once you've done that writing, and again, when we talk about resources in a minute, we'll give you some ideas about where you can find documents that will help you walk through these steps and actually write this information down. It's important to store it in a safe place where it can be easily located if needed, and also provide copies to your substitute decision makers so that they have those wishes recorded and can use them. I mean, it's more important to them, in fact, that it's important for you to have them and write them, but it's important for them to have them. So that's the important thing about planning or doing an advanced care plan. And I'll tell you just a funny story, in that my husband and I have done our work in terms of advanced care planning and have representation agreements and whatnot. And a couple of years ago, we actually had a house go on fire down our street. I mean, I didn't even know that house fires could exist in this day and age, but lo and behold, it happened. And so we ended up having to leave our house. It was in the middle of the night. And my husband had already put together, for when we travel, this list of what all of our bank accounts are, and our wills are there, and so our advanced care planning information is there too. So there I was, about, I don't know, 2 a.m, trying to think, oh my God, I've got to take stuff out of this house. What should I be taking? And, fortunately, I don't have a lot of expensive jewels, so my mind didn't go to that, but my mind did go to documents. And we do have this pile of documents that I then put in a briefcase along with my computer, because all the family pictures are on there, and off we trotted into the middle of our street. So the neighbors were looking at me, and with everybody else, might have had a bottle of water with them, but no other things. So what is in that? So I described to the neighborhood what I had in my briefcase, and everybody was kind of like, oh my gosh, we should have that too. So, you just never know when it's important to have these things and know where they are, and for you to be able to access them, and for other people to know where they are so that they can access them. And so that is my story on the importance of these documents and having them. So I'm going to go on we're just going to summarize now. So key things to remember: that you will always be the one that's asked to do these healthcare decisions as long as you can understand and can communicate. That you can change your advanced care plan at any time. Now, having said that, because the advance directive and the representation agreement are both legal documents, that if you change those, you have to revoke them. They give you a description with the documents as to how you do that. But, you can do it at any time. It's not, there's no constraint on you, but you just have to revoke them in a proper way. And if you're creating another representation agreement, just note that that's what it is. It's a new document. So advanced care planning isn't just a one-time event. It's something that we should be thinking about all of our time, and our thoughts, will likely change. Conversations get easier the more you have. I think that I know some friends that have been involved with advanced care planning that make it a kind of an annual event at the cottage just to go over. Now, remember, guys, this is the way it is, but every time they do it, it's become easier. And you have these different options that we've already talked about in terms of how you can express and record your wishes. So the steps, just a quick review again, thinking about it. And I actually think that if all you do today is decide that you need to do it, that would be the most important thing. Because when we go on to talk about resources, there are a zillion resources about how to do advanced care planning. The problem is people actually making a commitment to do it. So thinking about firstly doing it, and then about what matters to you, and then thinking about who do you want to make decisions for you if you can't, and then making sure that everybody knows both who you want and what are the things that are important to you now, to record this and to continue to revisit. So some of these resources, and on the information sheet that we send out, we have these different links, but the BC Centre for Palliative Care, which is the first website, has information from that center, but also has links to many other resources. So the resources that are most important to us in BC, firstly is the My Voice, the BC Ministry of Health. That website has information about advanced care planning. It's brief. It's the kinds of things that Karen and I have reviewed with you today, but it also has a book called My Voice, which is actually quite a detailed guide about how to prepare your own advanced care plan. And, a section for your wishes, a section for the temporary substitute decision maker list. It has the forms that you might use to do a representation agreement and to do an advance directive. So this resource on the Ministry of Health website is very helpful. Fraser Health has done some work and actually has a kind of an accompanying workbook to go with My Voice, because My Voice is a bit of a long document, and some people find it that it is a bit tedious, so because of the length. And so they did an accompanying one. And again, you can find all of these things through that first website that we've got up there, this bccpa.ca. There's a Speak Up Advanced Care Planning in Canada website, and it has lots of information, and also it has information particular to each province. So you can tell from how we've been speaking today that the laws that govern representation agreements and advance directives and whatnot, those are specific to BC. So other provinces have other legislation. All of the provinces and territories have legislation, but it's not always the same in terms of the terms that are being used. Like we use the term representative in BC. Not all the provinces use that term. So if you're from another province, it's really important that you get the information that's relevant for your province. And similarly, if you're an American, because we noted that the gentleman from Seattle wasn't with us today, but you know, the US has legislation about advanced care planning. And again, you need to check what your state's legislation is. And the other place that I went to because of the group that was going to be here today, the BC Cancer Agency has, if you Google advanced care planning, it'll pull up the ministry website that I've given you. It'll pull up the Speak Up Advanced Care Planning website as well. And it will also pull up the information that is on the BC Cancer Agency website, which is that booklet that I had mentioned, that Cancer and Advanced Care Planning. You've been diagnosed with cancer, now what? So I think there's a ton of information to guide you. It's this idea of actually making a commitment to do it that is the biggest challenge, I think. And so at this point, if there's any other questions or any other clarification that we should make, we're happy to do that.
Pat, Karen, sorry.
Yeah, go ahead.
Pat and Karen, I just have a question, I guess. It has to do with the representation agreements, or I think it was, anyway. It's about a sister or brother who may be in another province or outside the country.
Yes.
I think it would not be wise to choose either of those cases.
To have them as a representative?
Yeah, yes.
Well, it probably shouldn't be your first choice, but you know, the law does not say that they have to reside close to you. And sometimes people do choose people that are outside of BC. But, you know, you have to recognize that the healthcare providers need to be able to access these people. And so that to me is the biggest challenge. If you choose somebody who's on different time zones and all that kind of thing, it can really make it difficult in terms of being able to facilitate communication. So yeah, it's not within the law to limit you, but I think the practicalities should give you some guidance as to who to choose as well. Yeah, it's a good point, Len.
Norm, you had a question?
Yeah, I'm going to go back. I'm still thinking, because I asked a question earlier about specificity in the directive. I'm going to go back to what the advanced care plan might look like. What are the three most common things that people include in an advanced care plan, sort of in a general sense?
I think that's an interesting research question. I actually would like to know that myself. I know I have access to examples. Mm-hmm. And if you go to the BC CPCA website, there are some examples there to help, because I think that is one of the challenges when you start to think about this. But usually people start with some philosophical beliefs in terms of this sort of balance between how much they would be willing to suffer in order to seek treatment, and what also would need to be the goals of that. In other words, you might suffer more in relation to something that's going to add a lot of life or cure than if you're in a situation where you're likely to succumb to your illness regardless. So usually there is some kind of balancing in terms of quality of life versus quantity. That's your expression of how you would want that managed. And then I think it's more in relation to, you know, what your illness is and what you perceive as being some of the treatment choices. Okay, so I know these generalities are hard. You want specifics. So, for example, somebody that's on dialysis, they may be very happy to continue with dialysis to support their quality of life right now. They're cognizant. In other words, they're, you know, alert. Yes, dialysis, either doing it at home or going out to a dialysis center is a burden for them, but they're happy to have their life prolonged with that treatment right now. However, remember that when you're doing an advanced care plan, this is for a time when you're not going to be capable to making those decisions. So then they may, with their planning, want to express that if I am in a situation in which I am no longer capable of making my own healthcare decisions, and this is deemed to be a permanent situation. In other words, this isn't temporary. This isn't because I, you know, went for a treatment and I got some sedation and I'm 24 hours not able to make my decisions. This is a permanent situation. Then I would not want dialysis continued, because it would not be, I would not consider my quality of life at that point to be good enough in order to sustain this treatment. So put yourself into the situation of, you know, you've lost your capacity to make decisions. Is that a point at which you would not want treatments? Some people are okay about not having full capacity, but express in terms of what they would want, as long as I am having some joy in my life, in terms of being able to see my, you know, my grandchildren and appreciate my family. I would want my, you know, treatments continued. So does that help you a bit, Norm? It is it's a tough one, because I think in a way we do have to think about our own particular situations and what, you know, CPR, that's another one that people often include in an advanced care plan. I'm just reflecting on what is commonly thought about. CPR is one that is addressed because most life prolonging treatments, you have some time to think about, like whether you start dialysis or stop dialysis. Doesn't have to be a decision that's made within 15 minutes. CPR, unfortunately, to be effective, needs to be started immediately. If somebody has, you know, not had breath and heartbeats for a period of time, then in fact, you know, it's not a good thing to try to start CPR. So that's one that you know, we have to decide in advance. And the things that go into people deciding whether they want CPR or not, I think are burdens and benefits. And actually there's some good videos on Speak Up Advanced Care Planning talking about this whole CPR issue. But, you know, you have to look at your health status. I mean, if you're really frail and you're likely to sustain, you know, broken ribs and a lot of discomfort, whether you're aware of the discomfort or not, but I mean that the burden of the whole experience of having CPR and the chance of it helping you reduces as we get frailer. So there comes a point, I think, in a lot of people's lives where they decide that the CPR would not be an appropriate treatment for me under any circumstance. And then before you get to that, CPR isn't appropriate in any circumstance, often people are at a point of, well, CPR wouldn't be appropriate for me in the circumstance that I'm living with an illness that is likely going to cause my demise within the next 3 months or something like that. So those are the kinds of variations that you might see.
Could I just add something to that, please?
Sure, Karen. I mean,
Okay. another thing that a lot of people that I've spoken to include is where they would want to be cared for, home versus hospital, and that's a big one. Like if you want to stay home and you have enough medical support, like my mom, for example, was followed by the community palliative team, and we were very well supported with keeping her at home. Other people might feel like they feel safer and more secure when they're in a hospital environment. Totally personal, but that's where you want to be treated is something that lots of people want to include. And pain management, of course, and comfort, the things that give you comfort. And it might be music or a special quilt that your grandmother made, or it doesn't matter what it is, things that give you comfort and that you are comfortable in respect to pain management also. Those are the two big things I can think of.
But I realize what we're talking about are often the decisions that are made later in the advanced care planning process. So let's back this up a little bit and think about advanced care planning at different stages. So at the first stage, we're saying make decisions about organ donation, make decisions about the substitute decision maker, about the rep agreements and whatnot. Yes, if you can express your wishes at that point, do so. But it may be, just as was brought up in our conversations today, it may be hard to be more specific about treatments and whatnot at that stage. So this is an evolving process, and it's one that you will also be working with your healthcare providers on. So, there's actually an initiative going on right now in BC within, with healthcare providers about what's called a serious illness conversation. That when people have more serious illness, then to try to really encourage them to think about advanced care planning again. What are the goals of their treatment and whatnot? And again, so you have a serious illness. Well, you may recover from your serious illness. You may change your thinking again about that. But then as people move to become older, frailer, or living again with a life-threatening illness that has progressed, so then you're able to think about it again in a different way. So I think what you need to do is think about, where am I in this process right now in my thinking? And what are the decisions that I can make right now that are relevant? And look at this as an evolving process. That may be helpful to you. Where to begin?
It's Catherine.
Okay, I'll go. Should I?
Yeah.
So are there any other questions that we should be working with you as we puzzle through them? Because it isn't an easy process, but it's an important process to start and recognize the evolving nature of it.
Sorry, Pat, that was my phone just now, but I do have a question, and you've been approaching it, both of you. And my question relates to communication of your plan at a time when you may be in an emergency situation.
Mm-hmm.
And I'm wondering if either of you could address that. If for example, you're in a heart attack situation and the ambulance attendants have taken you to the emergency ward, who checks into
Mm-hmm.
whether or not you have an agreement, where it might be, and who can speak to it?
Okay, so my voice, the booklet from the ministry has a wallet card in it that they really encourage people to fill out and put that information in their wallet, so that and it does say, that yes, I have a representation agreement, and also if you have an advance directive and whatnot. If people actually have completed no CPR forms or have an advance directive that is about CPR, they always say to keep that by your fridge, because that is where the ambulance or emergency responders tend to look, because it's kind of become customary. And if I had those documents, I don't at this point in time, but if I had them, I would put a little note on my fridge that I have those documents and where they are right now. so going back, when you come into emergency, they certainly always do try to find out who they should contact. But I also should say that the legislation on consent allows for healthcare providers to provide care in an emergency situation, although they will usually try to provide care that's going to sustain life in an emergency situation. So it's probably of more concern for people that would not want, that would refuse the treatment that would be provided to sustain life, to try to make sure that they've got something in their wallet and by their fridge to make sure that your limits on what you would want were being communicated.
That's helpful. Thank you.
The other thing that is useful is that they are working on trying to integrate these medical records, so that the medical records that we have from one health authority are linked to the other health authority or linked to the ambulance. But this has been an ongoing work for as long as I've been involved in the healthcare system. And so at this point, I wouldn't rely on the fact that there is an electronic record, but I think that is where, the world is going. So hopefully that will also support us in terms of communicating our wishes to people.
There's also some free apps that you can put on your cell phone. They're called ICE, in case of emergency, ICE, that lots of first responders will look there if your phone is handy.
Okay.
And yeah, you can look those up.
Okay, thank you.
You're welcome.
No.
Are there any other questions?
Okay. Len is talking, but he's muted.
Okay.
Len, you're muted.